Hi, my name is Cassandra Parsons, and this is my presentation on the heart. I am in an anatomy and physiology class for medical assistants through Central Texas College. This is my final project for the semester. I chose the topic of the heart because my son has a heart condition, and it has always been interesting for me to learn more about the heart. Not only so I know exactly what the doctors are talking about, but that way I can feel confident in knowing how the heart functions and the anatomy of the heart. My presentation today is going to go over the anatomy and physiology, blood circulation, sounds your heart makes, ways to prevent some disorders of the heart, and treatments for different disorders. My goal for my presentation today is for you to be able to learn a little bit more about the heart and know why some things can happen and ways to possibly prevent yourself from having serious health complications. The anatomy of the heart is very complex. There are many aspects of the heart that help circulate blood flow. The picture on the right shows a brief overview of the heart. I'm going to explain the anatomy of the heart while explaining the circulation of the blood flow throughout the heart. At the top, which is called the base of the heart, you will see the superior vena cava, the pulmonary veins, pulmonary arteries, and the aorta. So here is the superior vena cava, the aorta, the pulmonary arteries, and the pulmonary veins. The superior vena cava and the inferior vena cava receive deoxygenated blood, which goes into the right atrium through the tricuspid valve and then goes into the right ventricle, which then goes through the pulmonary valve, out the pulmonary trunk into the pulmonary arteries. Here is your right atrium, your tricuspid valve, and your right ventricle. Superior vena cava, inferior vena cava. The oxygen-rich blood will enter through the pulmonary veins into the left atrium. Here's the pulmonary veins. Left atrium, through the bicuspid valve into the left ventricle, out the aortic valve, and then through the aorta. The bottom of the heart is called the apex of the heart, just right here. There are 4 pulmonary veins and 2 pulmonary arteries. Here is an image of how the blood flows through the heart. You can see how once the blood leaves the aorta, then it goes into the tissues of the upper and the lower body. When the blood flow leaves the heart from the pulmonary valve, it will go through the pulmonary trunk and through the pulmonary arteries, which then lead to the lungs. Have you ever wondered why the heart sounds a certain way? The sounds of the heart are from the opening and closing of the valves. Earlier we talked about the tricuspid valve and the bicuspid valve. The tricuspid valve, which is between the right atrium and the right ventricle, right here, and the bicuspid valve, which is between the left atrium and the left ventricle. The pulmonary valve is in the right ventricle and the aortic valve is in the left ventricle. The pulmonary and the aortic valves are responsible for the output of blood flow from the heart. A murmur is when the valves are not functioning right and you will hear an extra sound besides a normal heartbeat. You can be born with a heart murmur that can be harmless, or it could be something that needs to be corrected. Some of the symptoms of a heart murmur are chest pain, fainting, swelling, shortness of breath, weight gain. And if it's one of the heart murmurs that they say are harmless, you typically wouldn't see any symptoms with it. In this picture on the right, you will see the valves more clearly, which I had pointed out, the tricuspid valve and the bicuspid valve. There are ways that you can detect heart complications. This picture right here is a view of a normal EKG. This EKGs can also be called ECGs. An EKG is a test that can pick up abnormalities. An EKG can pick up different waves in the heart and how the heart is functioning. Examples of complications that can be seen in an EKG or an ECG is artificial fibrillation or hypokalemia. And right here you will see the P wave. The P wave is from the depolarization of the atria. The QRS complex is from the depolarization of the ventricles. And then the T wave is from the repolarization of the ventricular myocardium. Heart disorders. The most common heart disorder is hypertension, which is high blood pressure. An ideal blood pressure in adults is between 120 and 120 over 80. Stage 1 of hypertension is when your blood pressure is between 130 to 139 over 80 to 89. Hypertension can lead to other serious health conditions: heart failure, stroke, heart attack, more. Hypertension is when your heart is working harder than it should be to continue to circulate blood throughout the heart. Congestive heart failure is another serious heart disorder that can happen. When your body goes into congestive heart failure, this can affect other parts of your body. Your oxygen-rich blood is not able to circulate properly. That oxygen-rich blood is going to different organs in your body. So for example, if it can't go to your kidneys, then you could have kidney failure. Congestive heart failure is the cause for 1 in 9 deaths. Alcohol and cigarette smoking can affect your heart. This is why you hear the importance of not smoking or quitting smoking when it comes to heart health. The image above is from the National Heart, Lung, and Blood Institute. What the arteries can look like from smoking, which can block the blood flow. Sorry, this is an image of what your arteries can look like. So right here you can see the blockage. Alcohol can weaken your muscles in your heart, which then can lead to alcoholic cardiomyopathy, which is with excessive alcohol consumption over years' time. So an example was consuming 3 to 5 drinks per day for an increased amount of time can increase your risk of up to 50%, or increase your risk to 50% for high blood pressure. Cigarette smoking can lead, or you have a risk of getting congestive heart failure. Heart disorders can be very serious. There are ways to help prevent congestive heart failure. If you're a smoker, suggested to stop smoking. Losing weight can help with your heart health, and eating healthy food that is better for your heart, such as eating low sodium food, staying away from unhealthy fatty foods, staying active, and helping with your overall heart health. Eating and drinking low sugar drinks or food. Surgeries, treatments, doctors. There are treatment options for heart conditions, depending on the heart condition. There are lots of different surgeries, but I will just go over a few. One of them is having a pacemaker implanted. There are medications that cardiologists could try first, and if that doesn't work, then you're still having irregular heartbeats, this is when a surgery could be done where an implant of a pacemaker, which would detect if the heart is not beating correctly and could mechanically help make your heart beat. The next complication could be having a valve replacement or repair. This would be something that is done if you have something wrong with the valves of your heart. This could be done from an artificial valve, from a biological valve from a pig, cow, or human heart tissue. And then there's transplants as well. When you have a heart condition that needs to be looked at or followed by specialty care, or even to figure out what heart condition you have, you would be seen by a cardiologist. A cardiologist would help with testing, possibly medications, and deciding, seeing what is going on. And they can also help you with other heart healthy decisions to make. There's also a cardiovascular surgeon, which is one that can operate for surgery. In conclusion, the heart is very is a very complex organ in the body. It is responsible for supplying oxygen-rich blood to the rest of the body. The heart may look complicated, but once you start researching how the heart functions, all the pieces kind of come together. Eating healthy, staying active, and living a healthy lifestyle can help prevent complications and overworking your heart. And of course, sometimes there is situations that can just happen with heart complications. Here is the references for my presentation today. Here's a complete list. I also have in the presentation with the images, citations as well with text citations. Thank you so much for being a part of my presentation today. Hope you have a great day.